Emily and James, both Charles Drew and One World right here behind me, took this fight all the way to D.C. And here's why. Since about September, funding for community health centers like them had not had their funding reauthorized. Basically, that means the money expired. So leaders from local health centers traveled to D.C. They say to make their voices known. Typically, they treat uninsured patients. And Charles Drew CEO Kenneth McMorris told 3 News Now about 70% of its funding is at stake.
And so in the event that you have that uncertainty currently the way that we do, it's really hard for us to figure out what our next steps are going to be.
In fact, Charles Drew also went on to say it's possibly looking into closing sites and adjusting hours if its funding is not restored. And Charles Drew said it serves about 12,000 patients. About 90% of them are considered the working poor. There are about 7 community health centers right here in our state of Nebraska. Live near 120th and I, Shantae Passmore, 3 News Now this morning.